Another hormone secreted is vasopressin, which is also called as antidiuretic hormone, secreted mainly by the supraoptic nucleus of the hypothalamus. It is antidiuretic hormone, and it has different receptors, vasopressin receptors V1A, which are located in the blood vessels, liver, and brain. There are also V1B receptors, which are also called as V3 receptors, located in the anterior pituitary, and V2 receptors, they are mainly located in the kidney. The actions of vasopressin they are important for water retention. The major function of ADH is retention of water by acting on the kidney through the V2 receptors. The main site of action is at the distal nephron. It increases the permeability of the collecting ducts of the kidney. Due to the increased permeability of water, the water enters hypertonic medullary interstitium. Thus, diuresis is prevented. Water is retained in the kidney and urine becomes concentrated. Water is reabsorbed through the aquaporin 2 channels, which are ADH responsive water channels. So whenever there is increase in the osmolarity, or when it becomes hypotonic, it stimulates osmoreceptors which are present in the supraoptic nucleus. Then there will be secretion of ADH, which causes water reabsorption, and tonicity of the fluid is restored. And whenever there is a decreased osmolarity, osmoreceptors are inhibited, supraoptic nucleus is inhibited, ADH is not secreted, so water is excreted in urine and the tonicity of the fluid is restored. So, or whenever there is a decrease in the volume receptors present in the great veins and arteria, they are less stimulated, then it causes the third center to be stimulated, and SON is less inhibited, so there will be more increased intake of water, and ADH secretion is going to increase. That increases the water from DCT and DCD to be reabsorbed, and ECF volume is restored. So whenever there is increase in the volume receptors are stimulated, the thirst center is inhibited, and SON is inhibited, and ADH secretion is inhibited, which causes no absorption of water from DCT and CD, and the water excretion increases, so the ECF volume is going to be restored. Vascular effect. In large amounts, ADH causes vasoconstriction of the vascular smooth muscles, which are mediated by V1A receptors. Due to the vasoconstriction, blood pressure increases. The other actions of vasopressin, they act on the anterior pituitary and cause ACTH release, which are mediated by VNP receptors. It is a neurotransmitter in brain and the spinal cord as well. Vasopressin causes glycogenosis in liver, which are mediated by V1A receptors. Regulation of ADH secretion, it occurs by two important factors, that is osmolarity and the ECF volume, as we discussed through the charts. The other stimulants of ADH are pain, emotion, stress, exercise, vomiting, and angiotensin II. And some of the inhibitors of the ADH secretion are alcohol. Some of the clinical aspects: patients highly sensitive to vasopressin are prone to hypertension. In massive hemorrhage and shock, vasopressin is secreted in high amounts, and the pressure action of the vasopressin raises the blood pressure. Diabetes insipidus. Diabetes insipidus is the deficiency of ADH, and this disease is characterized by excessive secretion of water through the urine, that is polyuria, and increased water intake, that is polydipsia. Some of the causes are, it can be due to failure of production of ADH, so which is called as central diabetes insipidus, or it may be due to the inability of the kidneys to respond to ADH, which is also called as nephrogenic diabetes insipidus. Central diabetes insipidus, as we know, it is due to the inability of production or release of ADH from posterior pituitary. It can be caused by head injuries or infections, or it can be congenital. Because of the distal tubular segments cannot reabsorb water in the absence of ADH, this condition is called as central diabetes insipidus, results in formation of large volume of dilute urine with urine volumes that can exceed 15 liters per day. The treatment for central diabetes insipidus is administration of synthetic analog of ADH, desmopressin, which acts selectively on V2 receptors to increase water permeability in the late distal and collecting tubules. Nephrogenic diabetes insipidus. This condition, there will be normal or elevated levels of ADH, but the renal tubular segments cannot respond appropriately. So this condition is referred as nephrogenic diabetes insipidus because the abnormality resides in the kidneys. This abnormality can be due to either failure of countercurrent mechanism to form hyperosmotic renal medullary interstitium or failure of distal and collecting tubules and collecting ducts to response to ADH. In either case, large volumes of dilute urine are formed. Many types of renal diseases can impair concentrating mechanism, especially those that damage renal medulla. Also, impairment of function of the loop of Henle as occurs with diuretics that inhibit electrolyte reabsorption by this segment can compromise urine concentrating ability. The treatment of nephrogenic diabetes insipidus is to correct the underlying renal disorder. The hypernatremia can also be attenuated by low sodium diet and administration of diuretic that enhances renal sodium excretion such as thiazide diuretics.